We get questions about, well, I was told this by the emergency room doctor always gives me this antibiotic for my bronchitis, which, as an aside, bronchitis is a viral infection. You should never get an antibiotic. Bronchitis is not a real thing that needs antibiotics. So, but you receive something, and they said, this is what I'm supposed to take, and then I go to the pharmacy, and the pharmacist says, oh, why am I supposed to be given this? And then you go and see your usual doctor when you see them, and they say, well, why the heck are you on this and then that, and symptoms are better? Well, you should have this the whole time. They say, well, what's the role of the rest of that team? So I'll leave out the emergency room physician because they're not part of the team, but here at least we're lucky enough to have Ray and his pharmacy team that is here. And for everyone that this hasn't happened to, at least once a year we have you go through them. And we do that on purpose, whether you have 0 meds or 20 meds, to go through and make sure that the file on their end is clear as far as people who don't take meds, allergies. Because that's not, again, that's one thing that's not documented everywhere the same way. So if you're told one group once, don't assume anyone else knows. Especially if it's an allergy that you want us to know. You shouldn't actually be giving you something like that.
And that happens all the time. The doctor will write a prescription for antibiotic and it's penicillin. And you're like, well, we have that, you're allergic to penicillin. And you're like, yeah. They don't have that information at a particular office. So it does happen all the time.
Mm-hmm. Pharmacists get trained to be experts on the medications on purpose. So if you're going and where we're sending you, we say you need to speak with them about this, and they're going to go through a bunch of stuff, and it sounds exactly what you heard before, what we just told you. There's a reason. It's because more eyes on you is better than one for when something wrong happens. So that's why it's very important to have pharmacy here with us, and that we have a relationship with pharmacists in town. Because I can tell you, they catch things all the time, or make suggestions, and a lot of our patients will also ask, well, how much does that medication cost? I don't know. Maybe some Ray's educated me on, like that I can remember, but in general, I don't know. So those are important things as to why you need to have an entire team.
Or if it needs special authorization, if something's covered.
Yeah. I mean, if you don't want to wrap the strep done, you don't have to get it done. Yeah. Just remember, it can be a charge for it. Some places do charge for it. But it's nominal and it's a time saver.
You go to the pharmacy,
yep,
and they do the swab,
yep,
and they do the test right there at the pharmacy.
Yep, you're looking at 10 minutes. One result.
I've seen them do it here several times.
Keynote is probably 90% plus that it's negative. Most of the time it's viral. So most people think I have something with my throat, I need an antibiotic. You don't. Like I say, most of the time it is viral and it'll go away on its own. If something persists for 7 to 10 days, most likely, a sore throat especially, it could be bacterial. But like I say, 90+% it's viral.
Now, if we've been on the same drugs for a long time, same pills I should say, we can renew them through the pharmacy? Or do we always have to come back?
So pharmacists can renew most medications. Usually it's once. The time period is our choosing. I like to think of it as giving you a chance to give you time. Because if the doctor's giving you a prescription for a year, and we extend it for you, I think the doctor wants to see you.
Right. 90%
of the time, the doctor does want to. Sometimes it happens. Instead of putting 90 plus 3 repeats, it says 90 on it. It's just a typo. But most of the time, when you get a year's supply, they want to see you in a year. If not sooner. I mean, of course, things change.
No, that goes with, they give you 3 months supply.
Absolutely. Sometimes they want to see. Mm-hmm. I like to think of it as we the whole continuity of care. We don't want to all of a sudden don't take your medication. We want you to keep taking your medication, but we do want you to see the doctor now because you have that extra chance, extra time to do it.
So we've come to the end of our timing at least, so inevitably there might be questions out there that are still lingering. They're like, what I should have asked that I could have gotten an answer. Send them in, send them in to us on Facebook or our website or email. And then I know that they mentioned earlier about having some kind of support tool or checklist that our patients can actually have when they present to places. And that's what I have here. So it's our draft of what we're thinking we would do for people. So we're actually hoping that people that are here can take a look and see if this makes sense. It's not going to be exhaustive because if it's too big, nobody will take it anywhere. So trying to make it as common and as key points as we can to make it useful to more people. So I'll have it up here. Maybe I'll leave it on the table here and everybody can take a look. Feel free to write on it, make comments, or just tell one of us, actually I want this or I changed this. So that's the purpose of what that is.